Did you know that around 90% of new moms experience pain while breastfeeding at some point? You are not alone, and if you're wondering whether this pain is normal or what to do about it, this video is for you. Hi Mama, welcome to my channel. Whether you're pregnant, just gave birth, or deep into those newborn weeks, you might be dealing with something no one warned you about. Breastfeeding pain. Breastfeeding is natural, yes, but that doesn't mean it always comes naturally. In this video, we're going to talk about why breastfeeding can hurt, what might be causing it, and what you can do to feel better and feed with confidence. Here are the most common causes of pain during breastfeeding. If your baby isn't latching on deeply enough, they may be sucking mostly on your nipple, not the whole areola. This can cause cracked, sore, or bleeding nipples and sharp pain when your baby first latches. The fix is to make sure your baby's mouth is wide open, lips flanged outward with the chin touching your breast. Engorgement happens when your breasts are just too full of milk and they can feel tight, hard, and quite painful. This can make it a bit trickier for your baby to latch on, and it might even lead to clogged milk ducts. To help with this, try hand expressing or pumping a little before feeding to soften the breast. It can really make a difference. Repeated shallow latches or your baby slipping off can lead to some uncomfortable issues like blisters, cracks, and even scabs. To help with this, you can use lanolin cream, breast milk, or nipple balm between feeds. And of course, fixing the latch is key to preventing more damage down the road. If you're feeling a burning or stabbing pain deep in the breast after feeding, it might mean you or your baby have thrush. Other signs to look out for include white patches in your baby's mouth and itchy, shiny, or flaky nipples. The best course of action is to see a doctor because both you and your baby will need antifungal treatment. It's important to get this taken care of promptly. So, mastitis is actually an infection in your breast tissue. You might notice some intense pain or maybe a red, hot, and swollen area. Sometimes it even comes with fever, chills, or body aches. To help fix this, keep feeding to drain the breast. Also, make sure you get plenty of rest, drink lots of fluids, and contact your doctor. Antibiotics may be needed. If milk doesn't flow out properly, your ducts can get blocked, which can cause a hard lump and some pain. To help with this, try massaging the area gently during feeding, use warm compresses, and vary your nursing positions. If your baby can't move their tongue freely, they may struggle to latch deeply. A lactation consultant or pediatrician can assess your baby and suggest options, so don't hesitate to reach out for help. If you're still with me and this is helpful, don't forget to subscribe for more real-life tips for new moms. We're here to support you. Let's go over some simple, effective tips to make breastfeeding more comfortable. Baby's mouth should be wide open. Their nose and chin should touch your breast. You should feel a pulling sensation, not sharp pain. Here's a tip: tickle their nose with your nipple to encourage a wide mouth. Different holds really work better for different moms and babies. So try the cradle hold, which is the classic one, or maybe the football hold, which is especially great for moms who've had a C-section. There's also the side-lying position, which can be super helpful for night feeds and getting some rest. And here's a quick tip: using a nursing pillow can give you that extra support and comfort. After feeding, you can apply lanolin cream hydrogel pads or even your own breast milk. Seriously, it has some natural healing power. And here's another tip: whenever possible, air dry your nipples after feeding. A warm compress before feeding can really help get your milk flowing, and then a cold compress after feeding can reduce swelling. Just a heads up, use a soft cloth or gel pad, not direct ice, for the best results. You don't have to figure this out alone. A lactation consultant can watch your baby latch, suggest better positions, and check for tongue tie or oral issues. And, here's a quick tip: ask your hospital or pediatrician for referrals. Breastfeeding often helps relieve pressure and avoid clogs. But if it hurts too much, you can pump or hand express. Feed on the less sore side first, and definitely get support while you heal. Oh, and here's a tip: a silicone nipple shield can help short-term, but only under guidance. Pain feels worse when you're exhausted. You're healing, feeding, and loving. So be kind to yourself. And here's a little tip: drink water with every feed. Nap when baby naps if you can. Let's review what we've learned. Breastfeeding pain is very common, but it's not something you should ignore or suffer through. Causes can include poor latch, engorgement, infection, or baby's oral issues. Fixes might be better positioning, nipple care, warm or cold packs, and lactation support. Honestly, you deserve to enjoy breastfeeding, not dread it. If this video helped you, give it a like, share it with a new mom, and comment below. What part of breastfeeding has been the hardest for you? We'd love to support you in the comments. And don't forget to subscribe for weekly tips, real stories, and supportive content for your parenting journey. You've got this, Mama.